What are the typical laboratory findings in methanol toxicity? Methanol toxicity is characterized by anion gap acidosis and osmolar gap greater than 10. The clinical findings of methanol ingestion include systemic acidosis and direct neurotoxicity, secondary to the methanol metabolites, formic acid and formaldehyde. The main household item to contain methanol is windshield wiper fluid. The most important clinical clue to the diagnosis of methanol toxicity is disturbed vision. Formic acid causes ischemic nerve damage to the optic nerve. Bonus trivia. We spend about 5 years of our lifetime eating. FlashMed, video flashcards.